Can you turn the brightness up a little more? Hi, this is Dr. Buford. We're just getting started on the right knee. We're going to turn up the brightness to basically 100. And then the brightness button above that too. Yep. Okay, and so as we look in here, we're getting a good look at this medial meniscus. This is more the body of it. There's the posterior horn. If you look at the top of the screen, that's the area in the medial femoral condyle that lit up on the MRI scan, that little circular area. But I think we can get a pretty good look at it here and see that there's nothing loose, so that's encouraging. As I push on it, it's not loose at all, and the meniscus back here looks pretty good. So as we suspected, there's not much to do in this medial compartment, which is encouraging. And again, this is that area. You can almost just see the outline of it here. Okay, we'll show you some more in a minute. Okay, so here's a pretty good look at your anterior cruciate ligament. Your knee was stable, and the ACL looks good here. Posterior cruciate ligament's back behind here to the right, but that all looks good. And the next thing we're going to do, we're going to look at the patellofemoral joint. We're going to save the lateral compartment for last. But here, as we look up at the top of the screen, that's your patella at the top of the screen. Just keep the knee kind of rolled like that, maybe. Yeah. So that's the patella at the top of the screen. This medial facet looks pretty good. No signs of any significant cartilage problem there. We'll look over here at the lateral facet. You see a little bit of softening right there, right? But not too bad. And then as we track down the central part of the knee, we can see all the way down to there, and the trochlea there looks great. So I don't see any significant problems there. We'll sneak back up here. We can sneak around into this lateral gutter. And as we look back here, we don't see any significant problems. We're getting a hint of the meniscus tear on the lateral side, but we're going to look at that in a minute. I don't see any significant loose bodies to worry about. So we'll keep looking here in the suprapatellar region just to make sure. But so far it's checking out pretty good. Bend just a little bit more, yeah. Okay, so here we're looking in the lateral compartment finally. We start up here in the anterior horn. This looks okay. And then we get to this part that's split again. You can see that right there, where this superior leaf is split. And so one option is to just resect basically about 1 millimeter, 2 millimeters of meniscus right along here. As we look back up underneath, straight basket. That actually looks okay. We're not seeing anything that communicates with the surface in the posterior horn. We were suspicious because of the signal change on the MRI scan. But here we're right at the popliteal hiatus. You can see the popliteus tendon back there. And I think this is the part of the meniscus that we have to think about doing something with. Okay, we're going to try and taper this and take away as little meniscus as possible. You can see how we start working there. We can use our shaver to, can you grab that grasper and see if she can clean it? Use our shaver just to fine tune things, and also we can use the suction on it to remove any loose pieces. Okay, here's where we're at. We've got back to an even more stable rim. If I take much more of that, we're going to have two separate pieces of lateral meniscus because we're right at the popliteal hiatus. Probe, please. So I don't think I want to take any more meniscus. Here's the probe. So you can see that's still attached back here. There's the popliteal tendon running up, kind of matching the angle of the probe, running up towards 11 o'clock. Here's the area of the meniscus that we have now hopefully got back to a stable rim. We've got a couple little tricks to try and create some healing here, and we can certainly do a PRP injection in the office. But that bottom portion of the meniscus appears to be solidly attached, and this top portion appears to be pretty well attached as well. So I think we may be done. Okay, so I think we're just about finished here. We've made some little vascular channels at the meniscocapsular junction with the spinal needle, and now we're just making sure that there's nothing else to worry about, but hopefully this will do the trick for you, okay? So this will be the end of the video. Good luck to you now. Bye-bye.